If a person is on hospice, you might hear the hospice nurse or any of the hospice professionals say that the dying person is actively dying. So, what does actively dying mean, and what are signs that someone is actively dying? Here are 3 signs that a person is actively dying. 1, the person is not awake, they're not alert, they're not really communicating at all, they're not responding to you in any sort of way. They look like they're in a deep sleep or really unconscious state of mind. Number 2, you're probably noticing changes in their breathing pattern. So, for example, you might notice Cheyne-Stokes respirations. You might even see something called agonal breathing. Both of these sort of changes in breathing pattern where a person might breathe faster and bigger, and then there's long pauses between each breath. It might even look like the person is just taking small gasps of air. These are really reflexive breathing patterns that occur because the brain and the body is really shutting down. And number 3, you'll probably hear something called a death rattle, where basically you hear this sort of gurgling sound every time they take a breath. And it's really because the person isn't able to swallow anymore. So there are some secretions and saliva kind of sitting there, and the air passes over that sort of collection of saliva. My name is Katie Duncan. I'm a nurse practitioner and a death coach. You can check out my books, The Dying Process and Dear Caregiver, It's Your Life Too. Both are available on Amazon. If you want to work with me one-on-one or check out my online courses, go ahead and use my website, deathcarecoach.com. My link is in the bio.